Hello, and thank you for joining us. I'm Sandy Potter, along with Masonicare President and CEO, JP Venoit, and Dr. Ronald Schwartz, our Senior Director for Continuum Health Services. We're checking in with you once again with the latest Masonicare news and COVID updates. Well, it's hard to believe, but it's been about a year and a half now since COVID-19 was declared a public health emergency. This pandemic has certainly been a roller coaster of sorts. Unfortunately, we've seen an uptick in positive cases lately, many of which are being contributed to the Delta variant, even in areas with higher vaccination rates like Connecticut. JP, how is Masonicare responding to this increase in COVID-19 cases?
Sandy, over the past month, we've seen a pretty significant uptick in the state of Connecticut. And here at Masonicare, we've really stepped up a little more of our mask usage, our testing throughout our campuses here in Connecticut. And I think we're definitely spending a significant amount of time watching and looking. We've had a few areas where we've seen a little bit of an uptick in cases, and in those particular areas, we've increased our testing in our communities. But with that being said, a lot of it still is the same. Wear your mask inside of many of our communities, washing your hands, social distancing are all things that we're continuing to encourage all of our residents and our staff to do. But this virus isn't going away anytime soon. So we know as an organization that we need to continue to be vigilant in those areas that I said earlier, but also the vaccinations. Those that have been getting the COVID in, whether it's in our communities or outside in the public, we are seeing that the vaccinations are working, not only in preventing it, but reducing the severity. Those that have gotten it in our system recently, we've seen a less severe virus, which is good news. Still, with that being said, we are caring for our residents in any way, shape, or form to make sure that they don't get it, but if they do get it, that they are well taken care of. And I want to give a shout out to all of our staff for everything that they are doing. They've done an absolutely amazing job during this trying time, and they continue to put our residents first in everything that they do. That booster shot, which we are very excited that is coming, I think is something that we are looking forward to. And I know Dr. Schwartz is going to talk about the booster shot, but we are encouraged by that development that is coming very soon.
Absolutely, JP. Thank you so much. Yes, and speaking of booster shots, Dr. Schwartz, there is some conflicting information as to who will need to get one first and what timeline that should happen on. All of this is being debated as we're also getting news about another new variant that has now made its way to the United States. There's certainly a lot going on, as always. Can you fill us in on the latest developments?
Absolutely, Sandy. You know, it's funny. We've been doing these shows for about 10 months now, and there's still so much that we have to talk about. It's amazing, and today what I'm going to start off talking about is what we know right now about the booster shot. And I do have a nice article. Again, these articles are like 7-8 pages long, and I try to condense them just to one page, and I'll kind of read you the main information that I have. The title of the article is, "Will you need a COVID booster shot? Will one be available? Answers to your questions." So we start like this. They say on August 18th, the Biden administration announced that it planned to begin offering booster shots of COVID-19 vaccine to fully vaccinated adults starting September 20th. And they say people would be eligible for a third shot of either the Pfizer or Moderna vaccine 8 months after their second shot. So there's a quote that says, "This shot will boost your immune response," is a quote from Joe Biden during this announcement. And he said, "It will increase your protection from COVID-19, and it's the best way to protect ourselves from new variants that could arise." And again, it's not clear whether boosters will be available to the general public September 20th, Biden said the plan would need approval from the Food and Drug Administration and the Centers for Disease Control, CDC. And so far, it's he said neither agency has provided, this sort of direct guidance yet. So there's about 4 questions that I'm going to answer that this article sort of talks about. We'll start one by one. The first is, who can get a booster shot now? And they say the FDA authorized the 3rd dose of the Pfizer and Moderna vaccines by people with certain health conditions. And you may have heard of this, people that have compromised to their immune systems. And studies show that 2 doses have not provided the desired protection for this group. And they actually are more likely to get seriously ill with COVID-19. So I'm just going to mention some of the individuals in this group, different medical conditions. Those that have kidney, heart, lung, or liver transplants, are undergoing chemotherapy, have HIV, are taking drugs to suppress their immune systems to treat conditions like rheumatoid arthritis, lupus, or multiple sclerosis. And the CDC recommends people in these groups wait at least 28 days after the 2nd shot before getting the booster. So now we talk about, what about the Johnson & Johnson vaccine? And they say Johnson & Johnson says its single-dose vaccine, and this is a quote from them, generates strong and robust immune responses for 8 months, and that recent studies show that a booster dose further increases antibody responses among study participants who had previously received our vaccine. That's a direct quote. And the CDC says it's likely that people who receive the Johnson & Johnson vaccine will eventually need a booster, but federal regulators say they've not yet received the data to support that decision yet. So use of the Johnson & Johnson vaccine wasn't authorized in the United States until the end of February. So an 8-month booster dose wouldn't be available until October at the earliest. And then the 3rd question, if a 3rd shot is needed, why would someone need to wait 8 months after the initial doses to get it? Why not get it sooner? So they say, while the Biden administration said it planned to make the shots available after 8 months, the final guidance would come from the FDA and the CDC. And this was a quote from Dr. Cameron Wolf. He's an infectious disease specialist at Duke University. And he said there may be good reasons why sooner is not better. Sometimes waiting helps the body's immune system produce the strongest response against the virus or other pathogens. And the final comment in this article, does my 3rd shot have to be of the same vaccine as the first 2, or can I mix them? So this is what they say here. The problem with mixing vaccines, whether between the 1st and 2nd doses or between the 2nd and 3rd, is that scientists haven't studied the vaccines in combination with each other. The studies that led federal regulators to authorize use of vaccines all involve people taking the same kind. In other words, it's simply not known whether switching vaccines is less safe or effective than taking the same one. So these are some really good points, and hopefully just kind of condenses the main questions. And certainly there's still a lot to be answered, and we're still awaiting guidance from the CDC and the FDA. But as you asked me as well, just to talk briefly about this, as if we didn't have enough trouble, the new variant that's coming, I'm just going to read like a little paragraph about it. And they say, in another article we found, a new variant of COVID-19, which the World Health Organization says could have the ability to evade the immunity people get from vaccines and previous infections, has been detected in almost every United States state, and it's called MU. The B1621 variant was first detected in Colombia in January this year, and as of September 4, cases of the strain have been reported in 47 United States and the District of Columbia. The only states without reported cases are Nebraska, Vermont, and South Dakota. So again, this strain is currently most prevalent in Alaska, where data suggests that 139 reported cases account for 4% of the total 3,837 sequence samples. So you see, they name all these new viruses and variants alphabetically, and in Latin, and we're almost up to mu already. Before you know it, we're going to run out of letters and have to try some other alphabet. So it can be discouraging, and yet, as JP said earlier, in most situations, we're definitely seeing milder forms of things than we had in the past, particularly, and I think absolutely because of vaccinations. So we just have to continue to work together and to move forward. But I think having said everything that I said, it wouldn't be the same without giving my inspirational quote for the week, which I do have, and it says, "Life is not about how fast you run or how high you climb, but how well you bounce." And that was said by Vivian Komori. She's a CEO of The Broad Perspective, and I guess they produce many and author many inspirational quotes, this being one of them. So again, you know, we do have to bounce a lot with this pandemic, and we have been bouncing, but together we'll get through it as we have been. And once again, I thank everybody for their dedication and hard work, and I once again wish everybody health and peace. Thank you.
Dr. Schwartz, just to add on to the boosters, though we don't know when they're really coming out, we have been in correspondence with our pharmacy partners to really get ourselves situated to do the clinics for all of our staff, all of our residents that need it. So we don't know when it's coming out, but we are prepared to start our booster vaccine clinics as soon as we get the go-ahead, and our pharmacy partners are ready to go. So the good news is we are prepared for that to come out so that we can do it. So I'm very happy for that. I also wanted to just add on to Dr. Schwartz's comments of this has been a marathon, and when we look at our organization, we established a task force 549 days ago, and we had our first case that we were caring for 528 days ago. So we have been fighting this virus for well over a year, going on almost 2 years. But I can't tell you how happy I am at how our staff have really truly done an amazing job during this very stressful and very challenging time. So thank you. And thank you to our residents that have also had to endure some very stressful times at a time where, I think they want to be able to do a lot of the things. And unfortunately, COVID has created those restrictions, but want to thank them. Thank you for allowing us the ability to serve them each and every day.
Absolutely. Thank you so much to both of you. There certainly will be a lot of information coming out in these next few weeks, and we'll continue to come to you with these video updates with the latest, and as soon as we have any more information to share. And we'll continue to bounce, and we'll continue to stay Masonicare strong. Well, thank you for sharing your time and all the information with us as always, and thanks to you for watching at home. Until we see you next time, we hope you'll stay safe and stay well.